started.
Okay, so one of the questions I'm always asked once people find out I'm a doctor of some kind, or a particular chiropractor, they ask what kind of conditions I treat. And that's a difficult question to answer, sort of, in my case particularly, because I'm a chiropractor by nature, but I also specialize in a very little understood field of neuromechanics, which allows me to deal with two main aspects of clinical issues. One is neurological, that means pain related, and the other is neuromechanical, that means basically musculature, strength, stability, and fitness aspect, and rehab. So coming back to Main Highway, we have here Miss Lucy with us. She is an old patient from with us. She's been here since a few years back. I asked her to please join us today and do these nice little clips that we're trying to inform the public with. And Miss Lucy here, she was a stroke patient. She'll explain more. She's basically went into for surgery and to remove what was thought at the time to be a benign tumor, and basically cut an artery to where Lucy's entire left side was dysfunctioned. In fact, she had no control. Hemiplegic, basically, where the entire left side had no vitality per se, life. She got on board. I will let her explain exactly her experience, but she was a stroke patient who I took on board, and within a few months she'll explain how her experience went, etc. Hello Lucy, thank you for being here. Thanks for coming on. Please, if you don't mind, share your experience for us. Yes.
Yeah, hello, I'm Lucy. I'm a registered nurse, lives here in San Diego, Escondido, California. And what I can tell you is that I was diagnosed in 2014 with a brain tumor that I had to have surgery. So they removed the tumor, but at the same time during the surgery, I had one of my arteries of the brain was cut off, and it causes a stroke, having my left side paralyzed. So at that time, it was in 2014, I was under the care of traditional medicine, which under neurologists, physical therapy was the only option at the time. And I was doing that for a long time, but I wasn't even seeing any results. I was weak. It was taking a lot of from my body to go through that. So I was suffering a lot with back pain because my body was weak, so I was falling on my side all the time. And so that's when I came in looking for help. I found Dr. PJ. He helped me with the pain going through the back pain, being able to be straight. Then I was coming for the neurological treatments, which helped me with my muscles to get it stronger. This has been wonderful. Dr. PJ, thank you.
You're welcome.
See, before I was all the way like this. See, as you can see, my hand is not really still moving, but we're working on this. At least my leg, I've been able to walk.
If you want to demonstrate, please feel
See.
free. Yes. I like to see it.
See,
Nowadays, I haven't seen you for a short little bit.
And be able to walk even without a cane. It's been a long process, but see this happen maybe after 6 months of treatment with Dr. PJ and Marcus too. Both of them were able to help me.
Muscular therapist, specialist? Yes, ma'am.
See, now I can even lift my arm higher. Before it was all weak.
Drop to the side. You were very much.
Even my leg, I was dragging my leg. I wasn't able to lift it. I was so weak that not even be able to give a step.
But you're actually walking.
Yeah.
And do you use a cane or anything?
I
think
do
you
use
came
a
in with
cane,
something occasionally, but then my
Occasion
goodness.
for a long
This is so
distances
good.
because safety is important. But I've been able to walk and working through the recovery side.
One moment.
I'm sorry.
That's okay. That's okay. Come on.
Hi.
Hello, sweetheart. Come on, it's okay.
I need a keys for the bathroom.
Bathroom. Right there.
Oh,
Right there.
yes.
Wait a second.
Hey, look at you, you're all grown. Hi, how are you? Hello, Sarah. Good to see you. How you doing? Good to see you. Mark is here. This is Brandon and Josh.
Hello.
And look at you, little kid. You're looking like your daddy. Give me five. You got the keys, right?
Thank
Almost done, hon. Thank you so much for being here. You're gonna be on TV. You come back, we're gonna say something. Yeah. You gotta come and say it. Yeah, yeah. Fix yourself in the back. So you did the walking. Did we get disconnected or anything?
Kind
I
of.
didn't really go too clear because I had to shuffle and try to get the angle down. Did you?
Where did we pick
I
up?
got
real
some
fast?
of it. But if you would like, how far can you walk?
With the
You can
can.
go there. You
I
understand?
mean, it's just for the safety of, I don't
Right.
feel that.
No, no, you use
If
the
you
cane.
can
That's
take-
fine. Use
You
the
see
cane.
the can, I can walk.
Yeah, yeah.
Yeah, that's fine. And as far as this dot right here.
Okay, from here over there?
Yeah, if you
Yes.
don't mind.
Yes. With the can, correct?
Yeah.
Going back.
Nice to see. So as you can see, she's able to pick up, not quite almost there.
Yeah.
She did have to, for personal reasons, the last few months, not be able to come in as well. So in fact, the way you see Lucy here, she hasn't received treatments for quite a few months right now
Yes,
due to
and
personal
I don't know
issues.
if I mentioned too that I had, because at the end, the tumor result to be cancerous tumor, so I have to go through the chemo and radiation, which I think the treatments definitely helped me, because I was
To go
strong.
through the
To
chemo
go
process,
to the chemo
yes
and
ma'am.
the radiation. It
That's
really
what
helps me
healthy
to go
muscles
to,
do.
yes,
Mm.
my muscles were stronger, and that's what helped me to go through the treatments.